Hello, how are you, everybody? My name is Anna Devaj. I'm the social work cancer navigator at VA Puget Sound here in Seattle, Washington. And today I want to greet you and want to discuss addressing financial toxicity in veterans with cancer. I've worked here at the VA since 2004 and specifically with my veterans with cancer since 2008. So it really is a passion of mine, and I have seen many, many times that our veterans have financial issues and stressors, and it bleeds into the family, and they really require a lot more support, and that's what we're here for. What is financial toxicity? So, financial toxicity can have a lot of different words associated to it. You may hear it as financial distress, you might hear it as financial hardships, financial burdens of cancer, economic or financial difficulties, stress, distress. Basically, Duke University researchers coined the term financial toxicity in 2013 as the financial side effects induced by cancer treatment. And this also is an impact of financial burden on the veteran's physical and mental health, as well as that of the caregivers. So when we look at financial toxicity, it's not just the cost of the cancer treatment itself. It's not just the cost of the medications. It's not just the cost of your premiums, your um, co-pays, but it also is a lot more financial distress. Some factors related to financial toxicity include losing your job. I mean, there's so many times I have in the first time that I meet my veteran is they've just found out they have cancer and they're here and they are worried that they're going to lose their health insurance because they may not be able to work any longer. Also, if they need support, their spouse may have to take some time off to come and care for them as well because they may be getting some side effects of the treatment and they're worried. And it's coming on their mental health, it's affecting their physical health. So that is often where I get involved. That's often when they call the social worker in to be there to support our veterans. So I've been working here since 2008 in the cancer center, and I really love it. And I am always ready to support the veteran. So, other things that affect financial toxicity include um, the fear of not being able to afford medications or the treatments, also having to travel. The VA often has cancer centers, but they're in big cities. We're here in Seattle, Washington. So, if you're living a few hours away, you might be worried about how am I going to get to Seattle? How am I going to get the care that I need? How much is this going to cost me? So, one of the great things about RVA here is that we have resources for you. So, we actually have hotels for our veterans. Um, we can help with transportation. I'll talk a little bit more as we go. But those are some of the ways that we can alleviate some of the stress that comes along with financial issues and crisis. Um, our veterans worry because the financial toll could make them be fall back on rent, their utilities. Some of them even don't have enough money for food. So I'm worried about taking care of that, but we will address that as well. Something that we don't talk about or often think about, but there is racial, ethnic, and cultural disparities, with our veterans and how financial toxicity affects them as well. If you happen to have a good paying job that has health insurance and you can get through it, that's wonderful. But if you are worried that you're not going to have that, um, because maybe you're in a low paying job, or maybe you're a part time worker, or maybe you have been taking care of your family at home, that is where we can get involved as well. We understand that, and the VA really is trying to be more sensitive and inclusive of our veterans with racial, ethnic, cultural disparities. Geographic disparities is another thing that we think about with our veterans who live really far away. We know that some of our veterans feel more comfortable living, um, you know, in a quiet countryside, or just where they can have more independence. Maybe they can afford it more. I mean, living in a big city is more expensive. So, where can they be able to afford to have a home and a little more peace and quiet, especially those who suffer from PTSD and anxiety and depression? They may want to be a place where they feel not as stresses of being in the big city. So that is why we can offer lodging and we can offer other options for veterans who are living in those settings. Health literacy, too, is a very important factor. Some people don't understand medical jargon, as I say. So a lot of times we have to make sure that our medical providers also help better understand the information and provide that information to our veterans. So having understanding that health literacy, making sure that the information provided about their cancer and resources is given in terminology that can be understood. That our veterans, you guys can feel comfortable providing those questions that are necessary, so you can get all the information you need moving forward when you make a decision to undergo cancer treatment. Let's see here. Um, this is a psychological impact. So, financial distress increases and it leads to depression and anxiety. And we see this both in our veterans and in their caregivers. So, if we can address the emotional impact that financial toxicity affects, we can also improve veteran satisfaction of cancer care, um, because we know that there's been many times I'm talking with the veteran, and they're really worried about having to make a decision, because if they're not going to be able to work and pay their bills, they start making decisions as to maybe they need to delay their care. I have seen it where it's like, I don't get my next Social Security check until next month, till the first. I want to go ahead and I have bills to pay before I pursue my cancer treatment. Um, that is that those are decisions that are made, and sometimes they have to make decision. And if they have more resources available to them, and we can have that conversation, then with hopes that they may not have to forego their cancer treatment, that they can make a decision that's right for them, for each of you. Bankruptcy. Unfortunately, we know that studies have shown that those individuals who have cancer and have to undergo cancer treatment, over about two times as much, that they may have to file bankruptcy, and that is really terrible. Um, Luckily, I feel like at the VA we have options to that we can address when it comes to the cost of care. Unfortunately, in the private sector, that may not be the case. If and unfortunately, Medicare, you have Part B, you still have a 20% responsibility, unless you have, secondary insurance or some kind of special additional support that can cover that. So we know that people with cancer are have a higher likelihood that they will be exhausting their savings, even their retirement, to pay for care. So if we can provide all the information and support and look at resources, then that would be better not to have to go that route. Nobody wants to feel like their retirement nest egg is being eaten up because of cancer, and that's what happens. So, also poor quality of life. You have depression, you have anxiety, you have financial stressors, it can lead to a poor quality of life and increase your mortality as well. So, those are things to consider. And we'll talk about mental health resources available to you here at the VA that you can access, and we can support you along the way. And as we talked about, poor survival, if you don't have the resources available to you, um, and the emotional support to be able to cope with everything going on, that is also an important factor. At the Seattle VA for the last 5 years, we've implemented the cancer distress thermometer screening. We use the NCCN cancer distress screening, and it's provided at the initial care visit for our veterans. So if you're coming in and your first visit is with radiation oncology, or if you're coming into the cancer clinic for chemo, or even meeting with our cancer navigation team, you will likely be provided with an NCCN cancer distress screening where you will let us know what you're feeling. Where is your distress? The scale 0 to 10, and questions are asked regarding practical, emotional, family, spiritual, and physical concerns. Any score of 4 or greater, you'll be referred to an oncology social worker like myself or my colleague. But during this time, questions are asked specifically, are you having troubles with transportation, financial, lodging, emotional problems? And if the nurse says maybe you scored a 3, but you still have issues around financial concerns, transportation, or emotional problems, we often will be contacted regardless because we want to make sure that you can get through this cancer treatment with as much support as you can. But the cancer distress really is a helpful tool that we use to kind of see where we're going and what support we need to offer more to all of you. So here's where start talking about some financial and practical supports. So at the VA, we live here we're here in Seattle, and you may want to see at your local VA what is offered, but we do have contracts with some hotels um, for lodging that the VA covers, and they'll offer a hotel room for you and a caregiver with kitchenette, so that if you're going to be here for any extended period of time, especially if you're driving from a couple hours away, you're expected to do daily radiation, for instance, for 3 weeks, 4 weeks. That's a burden having to drive back and forth, very costly, and also physically and emotionally exhausting. So we want to make sure that you have the option of a place that you can call, I guess, your home for the time being. Um, Also, we have the Fisher House. So the Fisher House is right on their premises here on site at the Seattle VA, and some of our veterans, caregivers are able to stay there. So let's say that you're in the middle of treatment and you get pretty sick, and all of a sudden you're in the hospital and you're worried about your loved one who's at the hotel. What can we do to support them? The Fisher House is a good option. They can help both as a place to stay near the hospital. They're right on the premises. So your loved one's able to see you, provide you some support, help you through it, um, or even a hotel room. So those are some options that the Fisher House can offer. And again, at no cost to you. Um, if you are in treatment and all of a sudden you're going to need physical care, like a skilled nursing level of care, because your cancer treatment has been rough on you and you really need a place where you have 24-hour skilled nursing. The VA has both the community living center right on site on the first floor where veterans can stay and get the 24-hour skilled nursing care that they need so they can get through their cancer treatment with the most support, medical support, and also skilled nursing facilities if we need to use them in the community. We have contracts as well that we can access. Ideally, most of my veterans would love to be able to stay at home while they're going through cancer treatment. And if you live close enough, we have travel benefits that we can offer. The Veterans Transportation Services, the VTS van, one of us here at the VA, social workers or nurse, we can put a consult in to the veterans transportation for services. If you require a wheelchair van, we can look at the Cabulance. If you're travel eligible, we can offer that as well. Um, because of COVID-19 and the pandemic, our partnerships with the Disabled American Veterans Vans have been on hold, unfortunately, but we're hoping that as things stabilize, possibly we can get them back on board to start providing travel to veterans who are coming from, for instance, Bellingham, clear up in the Canadian border or, um, by the peninsula. So those are resources that we're hoping to, in the near future, get back using. And those are volunteers. So any of our veterans, even you back home, if you're thinking at some point you want to volunteer somehow, that's a really great resource. Um, I talked with my veterans. Some of them are very low income and they worry about even being able to afford food. So we have mileage reimbursement for some of them. So they can put in a request to get some mileage. I believe it's about 42 cents a mile um, if they're driving back and forth. And that helps offset the gas costs. Also, if they're staying in the hotel and they're low income, or they're service connected 30% or higher, or a VA pension, we can also have them keep their receipts. They meet with me and we can offer a meal per diem so they can get a little bit of money back from whatever spent for food, which is great because that's also a tough one. Um, these are additional costs that you are incurring because you're away from home. So that's another resource, and we can help you see if you qualify and how to um, fill those paperworks out for you. Um, Here at the VA, we also have donated support. So occasionally we have veterans who, gosh, I'm not going to get paid for another week, but I need to get food. So please talk to us. Please talk to your providers because we do have donated grocery gift cards, bus tickets, we have clothing, and track phones that we can get set up for you because we need to stay in contact with you and communicate with you. So those are additional supports that we can offer through special funding. Um, One of the things that happened because of COVID-19 is that our providers started thinking outside of the box. How can we provide the services that the veterans need and avoid the financial stressors of paying for gas, driving, the emotional um, toll it takes. So we've also increased the level of telehealth or virtual oncology doctor visits. So if you're here for a follow-up, the doctor might be able to have you go and get your labs done at a local clinic, maybe get the information sent in, and then have a telehealth or virtual visit with you to review that and see how you're doing. So those are some of the ways that the VA is thinking outside of the box to help provide support in order to reduce those financial stressors that could occur from a long drive. Finally, the Mission Act and community care in the last few years has allowed more veterans to access oncology care closer to their home. So that is also something that can be considered. And speaking with your doctors and speaking with our team, we can see what is the best, what's in your best interest, so we can um, honor your wishes and support you along the way. So here is the next slide talks about cancer care services at the VA Puget Sound. And there is priority groups. And so some of you may know or may not know, but um, the priority groups determine if you have copays for your care. So a person who is a veteran who's service connected at 50% or higher, you have a disability related to that you have incurred because of your military service, you don't have any copays. So 50% or higher, you don't have to pay for your doctor visit. You don't have to pay for your prescriptions or hospitalization. Priority group 2 talks about those who are 30 to 40% service connected. Priority group 3, Purple Heart recipients, former prisoner of war, service connected disabled at 10 to 20%. Priority group 4 is aid in attendance or catastrophically disabled. Um, and priority group 5 is a VA pension, non-service connected, or 0% service connected with annual incomes below the adjusted income. So more likely, those who are priority groups 1 through 5 could be exempt from medical treatment. They may still have possibly prescription um, copays, but they're pretty low. And I think I will go over that as well. And so you're aware. I know a lot of times people are worried because their cancer med in the community could cost a lot of money. And so that is why coming here could make sense, because just even if you have an oral chemo agent, it's going to be a lot less expensive here, more affordable than possibly if you get it in the community, even with your private insurance. Priority Group 6, it talks about those wartime era veterans. Priority Group 7, those are you're starting to look at people's income to determine copays. And then priority group 8 are usually those who have higher incomes and than what the adjusted gross limits are. So here it just talks about what those copays could look like if you do have a copay. So just wanted to talk about, like, if you're 40% service connected or less, you get free medications. Um, One of the things to consider is that even if you have to pay for your prescriptions, we have hardship waivers, because we know that at the VA, they usually look at your income from the prior year. That's your health benefit renewal form, your means test, as they call it. So let's say you were working the year before, and that's the income that the VA has. So you might be pretty worried that you're not going to qualify to get your prescriptions paid for or your medical treatment paid for. So one of the things we can do is, let's look at a hardship. Let's look at what your income could be this year and make a consideration of that, so that you cannot make those decisions about foregoing your treatment because of finances, because it really should be about whether you want to pursue the treatment. Um, uh, Something I didn't cover here, though, if you do have to have copay for specialty care visit, like if you do have to come in and you're seeing your oncologist, your cancer doctor, it's considered a specialty care visit. It's about $50 per visit. And if you have several appointments on that day, you still just pay the $50 for the day. So we try to work with our veterans to say, okay, I have to come in on this day for the oncology doctor, but I also got to do the IV clinic, and I'd like to see the dietitian. If we can bundle everything together um, on that day, then you'd only pay the $50. But again, we can work on hardships and update your income and help you through it. One of the things when I talk to my veterans, I really like to look at everything. I ask the veteran, did you serve during, where did you serve? Were you maybe affected by an exposure that you had in your service that could possibly be causing your cancer now? And sometimes they look at me and it's like, nobody's ever asked that, and yeah, I did serve, on ground in Vietnam. Um, or I was in Afghanistan, and I was around those burn pits. And so I want to just want to make sure you're aware that it's important to look at that. Maybe your exposure could have caused your cancer, and you could be compensated for that, and I would help you with that. So this is what I call service connected disability. So and I say some cancers are linked to exposures. So I know I've talked to Navy veterans who they were aboard a ship with asbestos, and now they have lung cancer. Well, we need to do an application for service connected disability if that's the case. Agent Orange also has quite a few different cancers that have linked, and they've already been presumptive. So if you served, in country during the Vietnam War, and you have one of these listed cancers, um, then you can also apply for service connected disability. Some veterans are exposed to radiation. other chemicals, um, and airborne hazards and burn pits, as well as water contamination at Camp Lejeune. So I've just listed some of the cancers linked to Agent Orange here. You can look there: bladder cancer, chronic B-cell leukemias, Hodgkin's disease, multiple myeloma, non-Hodgkin's lymphoma, prostate cancer, respiratory cancers that include the lung, larynx, trachea, bronchus, and soft tissue sarcomas, other than those listed there. So um, those veterans who served in the Southwest Asia Theater of Operations, this is now we're looking at the airborne hazards and burn pits. If you served in those Southwest Asia Theater of Operations after August 2nd, 1990, or in Afghanistan or Djibouti on or after 9/11, 2001, you may have been exposed to fumes, smoke from open burn pits, sand, dust, particle matter, general air pollutions, fuel, aircraft exhaust, other mechanical fumes, smoke from oil wells. So these are exposures that we now have a VA airborne hazards and burn pit registry. So I encourage you guys to definitely complete that. And although the VA does not have a recognizable presumptive list of specific cancers related to these airborne hazards and burn pits, I always say apply because, you know, they don't have the list, but it doesn't mean that it's not going to be linked. And if you're suffering from cancer and you were serving during these places, then definitely speak to your doctors to see if they think that could have been caused and put in a claim. And I work with our veterans as an oncology social worker to help them navigate that system of applying as well for service connection. Um, Most recently, we're starting to acknowledge also the Marine Corps base, Camp Lejeune in North Carolina. If you served at least 30 days there from August 1st, 1953 to December 31st, 1987, their water contamination, we now know that there's certain cancers that have been as a result of the water contamination in Camp Lejeune. These are leukemia, aplastic anemia, and other myelodysplastic syndromes, bladder cancer, kidney cancer, multiple myeloma, and Hodgkin's lymphoma. So, again, these are other acknowledged and recognizable presumptive cancers related to water contamination at Camp Lejeune. The process is applying for service connected disability. It's a Form 21, VA Form 21 526 Easy, and the statement in support of claim VA Form 21 4138. So those are the forms to complete to file a claim. Some veterans go to the local veteran service officer like American Legion, Vietnam veterans, veterans of foreign wars. Some of them have representatives that can help the DAV as well, Disabled American Veterans. Or if you're here, I can definitely help you guys with the process. Um, it's I will talk about other financial resources that we would address if you came to see me, or if we came into senior social worker. First thing I would say is let's look and see what resources financial you can access through your employer. We don't really think about it at the time. We're thinking, oh, yeah, I have sick leave. I have this many hours of sick leave or paid leave that I can use. But you may have already paid into a short-term disability program or a long-term disability program through your employer, or there may be a shared leave program. I know here at the VA, if you are running out of leave, you can work with human resources to try to get some shared leave. People could donate hours to you so that it extends your leave. And sometimes that means being able to keep your health insurance. If you have private insurance in the community, that's one thing to do as well. Um, Working with us to complete your Family Medical Leave Act, FMLA paperwork too, we can help you with all that. The doctors here. The next thing I think about is if it looks like you're cancer or recovering from your cancer could last at least 1 year, then we're going to be helping you to contact Social Security, which I do. I call Social Security and get a phone interview for my veterans, and we can try to apply for the Social Security disability insurance or the supplemental security income, or both, depending if you are not going to be having any resources at all. SSI might step in to cover the first 5 months waiting period before SSDI can go through. Some of my veterans too are already, let's say they're 63, 64 years old, and they never tapped into their early retirement. They've been waiting on that. But if they know that this cancer is going to be more of a long-term effects of it, and they're not going to be able to return to work, then um, I suggest we try to apply for both your early retirement, so you got a little money coming in, while we're waiting for a disability decision to be made, and that could potentially increase the amount you get afterwards. But again, those are conversations we can explain. Here in Washington State, we have the state paid leave program. So up to 12 weeks of paid leave for up to a certain amount of per month can also be additional support for those who are state employees. Um, and it's fairly new. Really been up and running the last year or so, but again, we can help you navigate those systems and access whatever financial resources are available to you. Finally, we have a lot of partnerships with community specific grants and veteran specific grants. So we contacting the American Cancer Society to see what specific uh, cancer grants there might be to help cover transportation costs or food or co-pays. Um, some of my veterans come from far away and they need help with a flight over here. So if you're within 1,000 miles, we look at Angel Flight West as their volunteer pilots and can get you here. Angel Flight West also has air miles available for those veterans coming here from Alaska, for instance. They can get an Alaska Airlines flight for you and your caregiver if need be. Um, Also, the Cancer Financial Assistance Coalition has resources. We work also with our neighborhood Cancer Lifeline, so they get grants for veterans to help offset costs for food, transportation, utilities, rent. Um, that's a one-time grant. So, but we try to utilize it when we need it. The Leukemia Lymphoma Society also has assistance with co-pays and emergency grants. Cancer care as well, and then for veteran assistance programs. So sometimes I might have a veteran's like, I have not been able to pay my utility bill or my rent is being due and I need help. And they live here in King County, and we look at the King County Veterans Assistance Program for them to see what can be offered, especially if they've not utilized the grant. I think it's a one time per year, but again, we can help you access these services and resources. Now I want to talk a little bit about mental health resources. So we know that as much as financial toxicity and financial distress can be affected because of the cost of cancer, it takes a toll on your mental health and your coping and the anxiety, depression. And so I want to make sure that our veterans, that you out there is thinking about if you need some support, mental health services at the VA is an option. Most recently, they've been doing virtual visits and phone calls. So if you're worried about having to come in because it's too far, that is also an option for you. And the VA's really been ramping up being able to give tablets to all our veterans. So if you need one, please let us know. That way you can be able to have your meetings with your doctors and your mental health counselors and psychologists and so forth. So that's really important. We know that even a person who has no prior history of trauma can have, PTSD in symptoms and anxiety and depression as a result of having cancer. Because, frankly, here's your life and there's so much uncertainty. So we know that, and then we have a lot of veterans who, you've been dealing with trauma, whether it's childhood trauma, whether it's trauma from your service, maybe it's combat or um, exposures, so whatever trauma, this can be exacerbated because of your cancer diagnosis. Because here you are now, you're fighting for your life. So we want to make sure that you're aware that you're not have to fight alone, that we're here to help you. We have cancer support groups here as well. Most recently, they've been done on phone, but hopefully we'll get back to face. I know that our veterans really like that. And there is support groups in the community. So if you want to join one closer to where you live, we can find out what is close by that if you want to join, or even join virtual ones. Um, we have caregiver support groups as well. Unfortunately, right now, because of COVID, ours is on hold. We're not doing it in person, but um, we do have resources of some that are virtual, and possibly in the near future get back to the weekly group that we love to have here for our caregivers. The veterans now have a comprehensive caregiver program, so there is a lot of support via the phone or virtually for our caregivers as well. So, and there's groups in the community. So please just reach out to us. We can go over what works best for you and how to access it. You do not have to go through cancer alone. You don't have to deal with the toxicity associated with it. We just want to be here to help you. Um, Also, vet centers. Sometimes we don't forget about those, but they are such a value. There's a lot of community vet centers that are in different places, and they also provide groups, PTSD groups, and emotional support groups as well there. And finally, I just want to always have the Veterans Crisis Line, the suicide prevention hotline, here available to you. At any time, if you, as a veteran or your caregiver, feels like you need support, you're not alone. Again, please reach out to us. We are here to support you and help you. It's not easy, and that is why we want you to know that you're not alone in this battle, your next cancer. In conclusion, I just want to just let you know that Department of Veteran Affairs, we just here at VA Puget Sound, we just want to continue to help our veterans. We want to help you guys through decreasing cancer distress and financial toxicity. We went over different ways we can do that, and we can help you offset out-of-pocket cost, and so that you're not thinking about the cost of the cancer. You're focusing on, you know, getting through it. That should be like in the back, not right now. Like let's, because you're battling this out now. We want to also continue to improve communication with your cancer team, including us, the oncology social workers, because that is how you build trust. I know that many veterans have a hard time trusting the VA. It's not a secret. You may have a hard time trusting um, another government agency. I get it. So we want to be here to support you and build that trust and rapport, and have you as a member of the communication. You're sole member here. It's not silos. We want it to be a team. And you, the veteran and the caregiver, are parts of the team. You're the center of our team. So please reach out to us. We want to communicate and improve the communication and build the trust and the rapport with you. Um, Another thing is we want to improve and increase access to cancer care services and mental health services to our veterans. So the telehealth and virtual visits is one way that we're doing that to help um, have more service to you, so that you don't feel like if you don't come to Seattle, you're not going to have access to care. And that's not what we want. But if you are coming to Seattle, we want to make sure you also have place to stay, transportation, everything that you need here to help you focus on getting the best cancer care treatment that you can. And also providing support to veterans and caregivers. Again, the veteran caregivers are part of the team. And we know some veterans don't have a support person, they don't have a caregiver. And frankly, sometimes it's beautiful to see that in our hotels, the different veterans that get together. They may not have a caregiver with them, but guess what? They're their own support. They create their own support group at the hotel, riding the van together. Those are some of the really wonderful things that you see here, the wonderful support you see. The VA mission statement is to